Okay, so as you may have detected from the intro graphic, this is a celebration of our birthday. This is 1 year of Coffee with EMBL, and it's a pleasure to welcome everyone who's new to this and to welcome back everyone who's been here before. Quite remarkably for me, this is the 13th Coffee with EMBL event that we've held. I really am astonished that 1 year later, we're holding these events and that people are finding them useful and coming back. The statistics have completely surprised me. So I want to say happy birthday to everyone who's taken part. Very exciting lineup and discussion and some really important things to discuss. I have to confess, when Lush first suggested we do this and asked me to be involved, I was both very nervous about how it would work technically. Just 1 year ago, the idea of doing online Zoom calls was not something I was especially familiar with. Boy, that certainly changed for me over the past year. I was also very unsure what appetite there might be amongst the community for participation in this event. And I can only say I've been pleasantly surprised, indeed astounded at what has happened, both how relatively easily it's been possible to technologically interconnect the community. Before today, we've already completed 12 of these sessions during the past year. We've had over 1,200 people register to take part. We've had representation from every continent, possibly excepting Antarctica, if I remember, but more than 40 separate different countries, all the way including South America, North America, Australasia. We've had people from all over Asia, from China, we've had people from Africa, as well as from all over Europe. I've been just amazed. Participants joining in from over 250 cities. I think that's a point we'll come back to shortly, but that global reach and the ability to interconnect a global community is something that has really made an impact on me, and I think presents a fantastic opportunity to play a valuable role in spreading fact-based information and promoting respectful, safe discussion of the most important topical events, providing a forum where we can learn from each other, support each other, and also help to provide a fact-based, apolitical, scientific discussion of the world's most important issues, which I hope will have real value around the world. So COVID is not what defines us. It has been something that we've learned to live with over the past year, and I fear we'll have to keep living with for some time in the future. But this forum has given us a chance to learn much more about it, and I think a lot of lessons have come from that we can take into future discussions. Another of the things that I found really exciting and successful about this is the breadth of interaction. I mean, obviously, from our community, we've brought together people who are still professional scientists. We've had some very, very senior world-famous scientists and research leaders on. We also have many younger junior scientists take part, and also people who provide a whole range of different roles, who were maybe trained in science originally, but have moved into communications, into the media, people who are working in the legal profession. We have lawyers involved. We have teachers involved. We have administrators, accountants. We have a broad church of participants, and that's really important because I think everything we need to discuss and talk about isn't a surrogate for the conventional scientific conferences, but rather a chance to bring a fact-based understanding of the important issues in an accessible format that is relevant to all of our communities and which we can share. And by having a global reach and interacting with people around different geographies, we can also understand the unique problems that occur in different locations and hopefully support each other in finding solutions to our problems there. So as you see, we amongst the 1,200 people more than 1,200 who registered, and we have people with a huge range of different backgrounds, professions, and activities. And that's a great strength of the forum. Okay, I think we've got a lot to get through today. We have a really interesting discussion, and COVID-19 was the origin of Coffee with EMBL, and the thing that 1 year ago, as lockdowns were starting around Europe, discussion was rife about how we should deal with the pandemic, what would happen. No one really knew what was going on, and that's what initially brought us together in this forum. 1 year later, COVID hasn't gone away. It's diversified. We now have a range of new and more infectious variants that are promoting second and third, possibly fourth waves. We've learned a lot more about what's happening with the epidemic, but there's still a lot of uncertainty. One of the stories that I would like to share with you, I'd like to bring in now Akhil from India. Akhil trained in Edinburgh. He is a human rights lawyer. And I believe I'm right in saying that, Akhil, you were one of the very first people in southern India who actually were tested and shown to be positive for COVID. So I don't know if we've had anyone who was COVID positive or who admitted they were COVID positive speaking at Coffee with EMBL. So again, you may be the first, but your story is quite remarkable. So we'd love to hear your experience when you discovered that you were COVID positive.
Yeah, thank you. Thank you, Angus, for making me part of this discussion. And also thank you, Manoj, for bringing me onto this platform. And I would like to convey all my greetings to the EMBL community right here. I've taken it as an absolute honor to be part of the state-of-the-art institutions platform today, to share my experience of what I've had dealt with COVID-19 over the past 1 year. And the topic today, 1 year on with COVID-19, is very much relevant to what I'm going to speak. Okay, so directly answering what Angus has right now asked. Yeah, I was one of the very initial people in India to be tested with COVID. It was in March 2020 where the pandemic was just about to show its actual form. Okay, India still did not even have an idea of what it is going to be like. Not just India, many parts of the world still did not. I was in Edinburgh at the time when my classes were still going on, but UK government has announced that they are going to impose a lockdown. And one day I went into the market to get some groceries, and I could see the scenes where all the supermarkets were completely empty. Like, people have shopped, like, I think for a year. Okay, everything, just all the essentials were out of stock, and people queuing up outside grocery stores at 5 o'clock in the morning at the time when it was snowing. So this kind of made me feel like, what am I going to do here? Like, if the UK is going to enter a lockdown, what am I going to do here? And at the same time, I got an announcement from the Indian embassy that India is going to close its borders for people traveling from UK and Europe in the coming 2 days. So at that time, my family had actually did not even discuss further. They have just sent me flight tickets. Your classes are over, university is shut. There's nothing that you're going to do there. Just pack your bags and come back. I also had nothing to say back to them. Then I was like, a lot of my friends were also traveling back. So I did pack my bags, and I just had a few hours of notice to leave. But the only thing that I did is I told my parents and also my friends that, yeah, I'm coming back, but I asked them not to come to airport to pick me up, as how they do usually whenever I go. I did stay in Germany earlier. I stayed in UK. So whenever I went abroad, whenever I'm coming back, it's as a normal custom. They come pick me up. That's how it's done. But this time, though I have a heavy luggage with me, a lot of baggage to, I did ask them to not come. So, and a lot of my friends did not understand when I'm telling them not to come, because India has seen such kind of viral infections before, like swine flu, Ebola, okay, MERS. We have heard of something that comes from abroad. Okay, but India has never experienced anything that would close their borders. Okay, so people still did not realize what I'm trying to tell them. So I have asked them to not come to airport to pick me up. I just wanted to get tested before I go. So as usual, I got landed in India. And one another important thing that I have to mention is, at the time, the WHO as well as my university's guidelines to suspect to suspect yourself if you're COVID-19 positive is you'll be having a lot of dry cough, high running fever, running nose. So these are and breathlessness. These are some things which you would have if you are COVID positive. So these were clear cut instructions telling if you don't have, there's nothing to worry. So of course, I did not have anything. I did not have running fever. I did not have dry cough. I did not have running nose. Nothing. I was absolutely normal. So I did travel. I got landed at the airport. At that time, India was compulsorily quarantining people coming from the Gulf countries, Saudi Arabia, Dubai, Qatar, Bahrain, people, Iraq. So, but people coming from Europe and UK and the United States, they were free to enter the cities. So when I asked them, see, I'm coming from so and so country where the government is actively promoting herd immunity. Uh, People did not know what herd immunity was. Uh, so I told them, look, I'm coming from UK, especially Scotland, where everything, the clubs and everything were very wide open. And there's a concept called herd immunity. The government did want everybody to get the virus so that it'll end sooner. So they were like, sir, we don't want to test you because you are not coming from a country which is on our list to test. So they said, if you still want to get tested, you have to go outside the airport, take a vehicle, go to so and so hospital. Only then you can get tested. So I did wait for quite few hours. Then I took all my baggage. Then I went to a government state-run hospital. So I told them I'm coming from so and so place. Then even then they were not ready to test me. They're like, but you don't have any symptoms. I'm like, yeah, I don't have any symptoms, but I'm coming from a country where people are testing positive. I'm not having symptoms, but I'm coming from a country where a lot of people are testing positive. So they were like, they were forced to test. I in a way compelled them to test me. So they did test, and surprisingly, my test turned out to be positive. And nobody, I myself was not ready to listen to that news, because the only thing that I went to get tested is to hear a news that I would be negative so that I can go back home. I can spend time with my family. But to my shock and to everyone's shock in my family, I turned to be positive. And just imagine, like, I'm positive, and the news spread like anything. Like I started getting a lot of phone calls from media, everybody asking me, "Are you positive? Are you positive?" So at that time, I had to actually make a public statement on my Facebook and on my social media platforms, telling I traveled to India yesterday. I went for a test. I did test positive, but this is to kindly inform everyone that I did not meet anybody post my arrival in India, and I straight away turned up at the hospital. I did not even meet my family, because the reason why I had to meet this is there was a lot of stigma attached at that moment. People were literally discriminating you on the basis of COVID. I have heard of instances which my family faced. Like, my family did not even see me when I came back to India. But people, after hearing that I tested positive, they were even skeptical to talk to my family. I mean, my neighbors, a few of my neighbors, because that was the amount of stigma attached at that point of time. So, and when I was actually entering the hospital, after I tested positive, I was entering the isolation ward. I was hearing certain people talking that people entering this isolation ward would never come back alive. So that is what I actually had to hear before entering the isolation ward. And the situation, I don't know if all of you could imagine how it was. We were all decked up in our PPE kits. We were completely covered in the masks, gloves, everything. I stayed in isolation for 15 days. I do not remember a single person's face in the isolation because I did not see them. I did not see the doctor who treated me. I did not see the nurses who treated me. I did not see the healthcare workers who helped me get food. I did not see anyone. Neither did they see my face. Nobody knows anybody. That is the kind of situation where we had to go through. It was definitely, though I did not suffer anything physically because I had no symptoms, mentally it was a huge strain, huge stress to take, because it was never ever imagined that I would sit in a hospital right after coming back to India and sit as decked up in some kind of blue PPE kits where somebody keeps coming every 1 hour, taking the blood tests, they keep taking X-rays, they keep asking you questions, the police call you a lot of times asking to cross-examine, to interrogate whether I have met someone before entering the hospital, because every single day I used to get called from the police department asking, did I meet anybody before entering the hospital? Did I meet anybody? I was so thankful to my own conscience that I did make a decision to not meet my family before entering the hospital, or else the situation would have been entirely different. Like they would have I think they would have completely asked my family to leave the city or something like that. But thankfully, that is something I would be thankful to myself for all the time. And the other thing that you have to see is when I was in the hospital, I did. I had to experience people dying right in front of me. People who were all fine in the morning, who were talking, no complications, nothing. Sometime in the night, suddenly they start feeling breathless. After some time, even before the doctors realize what's happening, they used to die. I had to see so many people die right in front of me, wrapping their bodies in some kind of zip bags. They wrap the bodies, and the bodies were not even handed over to the uh, families of the deceased.
This must have been a very frightening experience for you.
Indeed, it was very frightening because I did not tell anything that was happening. I did have access to phone. I did have access to my laptop, but I did not tell anything that I was seeing right in front of me to any of my family members. I used to talk to them every day, but all I used to tell that everything and everybody around me is fine. But it was just like a countdown. Today, this person died. Tomorrow, that person is going to die. When is my turn? That's how it was, because nobody knows what was going to happen. And it was like,
yeah, and I understand, Akhil, that you played a fantastically valuable role from this in helping to establish a plasma bank.
Yeah. So that is the experience that made me start a plasma bank, because after I got discharged, after almost 15 days, one day I get a call from the same hospital telling they want plasma. So I actually did have an idea of what plasma was because I was trained in paramedics, and I did know what actually convalescent plasma is, because they did use plasma for some other other diseases as well. So I said, okay, I'm willing to volunteer to donate plasma. So they said, you have to come on so and so date, and we will want to take plasma from you because the government, the Indian Council for Medical Research, the top-notch governmental agency for medical research in India, has given us the permission to conduct trials, because that is the only promising treatment which we see right now, because there's no drug, there's no remdesivir, there is nothing yet at that point. This is May 2020. So they asked me to come and volunteer. Then I went. The police department has given me a pass to travel because India was under a strict lockdown at that point, the absolute curfew on roads. So I had to travel almost 150 kilometers to go to that hospital. I did go after I donated the plasma. The next day, I see, or not even next day, the same evening, I see lots of media vehicles queuing up outside my house. That is the moment I realized I was the first person in the whole state to donate for plasma. I was not expecting that because I was the 16th patient in the state to recover. So I expected that before me, a lot of people recovered. So all of them would have donated plasma. So I thought it was my turn to donate. But then I realized out of hundreds of persuasion calls made by the hospital, because after me also a lot of people recovered. This is a month after I got discharged. And after the hundreds of calls made to hundreds of recovered people by the doctors, not even a single person turned up. So that is when that is something that has moved me, because plasma was very promising at that point of time. Convalescent plasma was very promising. So I started a website along a few of my friends in UK, friends in Australia, friends in US. So we used to work in shifts because everybody is in different time zone. So it was quite convenient for us to work in shifts. So we used to work in shifts and we used to take requests from people, and we had to set up a team which used to pursue and which used to give clarifications to recovered people of why they have to come and donate plasma. So slowly, we increased the database of donors. Then we started connecting those donors to the patient requests we were getting from the nearby hospitals. So that is when we started to connect the patient and the donor. And this was going on smooth for 10 days. And after 10 days, we realized that there was one donor and 4 to 5 patients waiting for the same donor. And after a few days, it became one donor and 10 to 15 patients waiting for a plasma of the same group. Then a few of the patients started to offer this particular donor that I'm going to pay you so and so amount of money. I'm going to pay you £1,000. I'm just converting into pounds, so it will be easy for you to understand how much it is. So they're offering a huge amounts of money to the donors, where a lot of donors were actually going to people who are offering the highest amount. It was like a bidding. Whoever buys me for the biggest and highest amount, I'll go and donate it to that family. So that's how it was happening. So that is when we realized that we need to break the chain between the donor and the patient. We should not let the donor and the patient know each other. But as a private agency, as a private group of 10 individual students, it was indeed not possible for us to handle all of that. So that is when we started a campaign that we need a state-run plasma bank. We need a plasma bank where people recovered directly go and donate regardless of the need for the plasma. People donating in the plasma bank should not know who that plasma that they donated is going to be used for. So that is how we started it. That was the whole idea behind that. We started a social media movement with the hashtag that we need a state-run plasma bank. We did pursue on Twitter, we did pursue on Facebook, everywhere. We have started sending a lot of letters to the government. At a point, we did get a response from the governor of the state telling the government they have started exploring the possibilities of establishing a plasma bank, and slowly that has taken into actual shape. So that is when we had we could cut the black market that was booming around plasma in India.
So, Akhil, I think this has been a remarkable story and very helpful for many of us to put a human face on the reality of the situation, and also a stark reminder of how situations can vary enormously in different locations, especially if there is what one might call a vacuum of political direction or leadership, and perhaps also a lack in the broader community of perhaps some scientific understanding of even knowing what plasma is or what it would be used for. And that's something I'll come back to in just a second as a role. I hope you can stay on and perhaps engage in the rest of the discussion. But I think we've all been really admiring of the role that you played in starting this initiative, and the fact I hope that it really contributed to saving lives is something you can be very proud of. So India, obviously, at the moment is one of the many places in the world where the COVID pandemic continues to create serious health issues. Obviously, one of the other areas moving across continents in South America, many South American countries are having a terrible time at the moment. And I'd like to bring in Carla from the Medical Biochemistry Institute in Rio de Janeiro. Carla, hello. Thank you for joining us.
Hello.
So we've been hearing of some of the difficulties that are currently being faced by multiple South American countries, but Brazil prominent amongst them. And again, with the view of a local on-the-spot report, could you share with us your own feelings or experience about what's actually happening in Brazil, and perhaps why it's happening this way, or where things are coming in terms of political leadership?
Yeah. Well, first of all, thank you all for being here to listen to us, and thanks for the invitation. So I'm very pleased to be invited for the 1-year commemoration here. So what can I say about Brazil? I think everybody's hearing a lot about Brazil right now. I think we are at the center of the epidemic right now, right? We have about, I think, 10% of cases and deaths in the whole world right now. And the situation, we are now at the worst situation ever during the pandemics. So, and I believe, like as you said, like there's a vacuum of direction by the government. I mean, it's difficult here for us to separate the pandemics from the way the government's dealing with it. I believe, like, and I mean, it's not just me; it's just a personal belief. It's been everywhere. Like epidemiologists are talking about it. The problem is that we didn't have a prompt response from the government. The government was sending mixed messages, like depending on what was going on in the head of the president, mainly, I believe. And so one day the use of masks wasn't important. The other day, maybe, depending on what wasn't being needed at the government, the mask, so the president would use the mask. And so the government was signaling it in a very bad way. Well, it was like was giving mixed signals to the population, and unfortunately, I think it's not only that people got confused. That when there's like a group of people that still believes in what's being like the message that are being sent, like the fake news, the fake messages that are being sent to the media. And so there's still people advocating for hydroxychloroquine, ivermectin, and other medicines that we all know don't work. These medications were actually being so that is what they call here kit COVID. And the kit COVID is basically hydroxychloroquine and ivermectin, and then the health ministry was actually giving this to hospitals, and there were cities that were using the medications. I think this week, what happened, like in Amazon and Manaus, people were using hydroxychloroquine, like the vape of hydroxychloroquine, and some people have died because of that. So we see that, like, we are at the worst of the pandemics, the highest numbers ever, and people are still advocating for the use of the medications that we all know that don't work. So clearly there is like a mistake. I don't know if it's a mistake in terms of we did it because, well, actually no, it's not like because they didn't know it wasn't going to work, right? It's just like they decided to go for it. There's a study here in Brazil from researchers saying that that all that has happened up to now was actually really thought by the government. So we are not here at the situation we are right now just because it happened. It happened because we didn't have clear directions, and there's as you know, I mean, there's a lot of inequality in Brazil, and things have happened in different places with the more burden or less burden, and depending on how things were communicated, how the actions that were taken by the people that have to take actions. For example, I'll give again the example in Manaus, because it was like pretty bad, not long ago, and so the beds in the hospital, they didn't have a good number of beds for everybody. They knew that from the beginning. The number of cases were rising, and nothing was done until they got to the situation where there was no oxygen, and when there's nothing else they could do, and then they decided to send the patients to other states. So if you try to analyze every single state, every single city, you see there is a lot behind of lack of attitude from people that should take the actions. So we feel very what is the word? Like, we feel we are not being directed. We don't have anybody to look after. The population doesn't have anybody to look after them, basically. There's a big fight between president and governors, and who should and who is allowed to decide for lockdowns and so on. So it's a big confusion here.
So thank you very much for updating us in the situation. Clearly, as we're seeing, the pandemic continues to rage, and it also illustrates your story and also Akhil's story, remind us of problems of communication. Where do you get your communication? Do you rely on the government? If the government has a particular agenda that doesn't fit with the facts, you can misrepresent information. I think this is one of the things that is inspiring us to consider whether EMBL, or the Alumni Association, based on what we've discovered from the ability to communicate globally via a forum such as this, we are actively considering launching a YouTube channel to promote fact-based information about important scientific issues that would give an opportunity for building trust, being apolitical. And I mean by that we are not aligned with a political ideology or point of view, but rather wanting to promote accurate, fact-based discussion of important topics relating to health, disease, science, the importance of basic science, climate change, the environment, all these issues that are key today. I really hope that could be helpful in this situation.
Yeah. When you were asking at the beginning of the meeting here, if you should do that, this is one question that you made, and the first thing is, you should do that. That's I think it's a role that us as scientists should have in the society, is to bring the fact-based truths to people. But there is another thing that I really believe we should we should think about it. We should find ways to bring it to the population. Because what we've been seeing here in Brazil is that it's not just a matter of, it's not just a matter that you can just say, like, well, this way, hydroxychloroquine doesn't work. We know it's based in evidence. Science knows that. I know that scientists that study that, and he knows that for sure it doesn't work because that doesn't convince many people. It's not like most people, but many people. And those people that are not convinced, they actually have an important role in the society. And like we're saying here now, it makes things mixed up. And they still, so that we have to find ways as scientists to talk to the heart of these people and showing them the truth in a way that we are able to convince them. Being apolitical is one of those things, I believe, but it's not sufficient. So we really have to think about how to do this in the best way to convince people. And I think that's the work that we have to do now as scientists for the society. It's not just making science, producing his results. It's really about thinking about how to get to people and to show them that this is really important and that some facts that they cannot be so different because it's the truth, but how to convince them it's the truth.
Yeah, and obviously I agree with you. And I think one of the things that's impressed me has been a real unexpected emergent feature of doing these Coffee with EMBL events is the fact that we can have an insight into the reality of situations for people. Today, we've heard from India. Now we're hearing from Brazil. We're going to come back to Europe. I think that can be a very valuable way of really sharing experiences, making it real and not abstract, but actual, having communication from people in different geographical locations who can talk about the issues, but bring a perspective that is very fact-based and not ideological, driven by politics. Clearly, we could go around the world and there's many situations where the controlling, for reasons of political belief or religious belief, you can distort facts. and so at least having a reliable, trustworthy source where people can feel with confidence they can turn to discuss or be informed in a fact-based way, I'd like to think would be a valuable thing we could contribute.
For sure, it is.
So the issues that, we all realize that the pandemic, of course, has posed difficult challenges to governments around the world. And I do realize the difficulty of having to make important decisions quickly in real time, where you want the scientists to tell you a definitive answer, but the facts aren't there yet to know in advance what's the best course of action. A good example, one of the things we've discussed a lot in Coffee with EMBL that's evolved during the course of the pandemic was what is the prospect of having a vaccine? 1 year ago, this was something that we were discussing and debating vociferously. I think I'm right in saying that we were told that there had never been a successful vaccine developed against the human coronavirus when the pandemic broke out. So to place all of our hope in the drug companies in record time delivering a vaccine, well, it wasn't something that we should have taken for granted would be successful. I have to say, one thing that has happened I'm pleasantly surprised by is how many companies have produced efficacious vaccines. It is quite remarkable what has been achieved in this regard. And yet now we have the strange problem that the vaccines are produced. We have political problems about where they're being distributed around the world, or even in different populations, a different attitude as to whether, if you're offered the vaccine, you agree to take it. There's a very interesting thing where I think more education is needed to evaluate risk. Is it, should you be more worried about the incredibly small risk of a brain clot, or that you might die of COVID? These are very difficult things to balance. Also, in terms of advice, I was watching a really interesting interview this week with someone called Johann Giesecke, apologies to my Scandinavian colleagues if I'm mispronouncing the name. He's a very well-known Swedish epidemiologist, I believe, who 1 year ago I watched being interviewed, and he was one of the people shaping a different direction of travels for the Swedish government as opposed to many other European governments in how that country responded to the pandemic. Now, I believe we have several participants from Sweden online, and I would like to invite them to participate here. My understanding today is I saw an interview with Johan Giesecke he carried out this week, coming back to look at what he forecast to happen compared to what actually happened, and to compare in Sweden how things like death rates or the effect on the population happened when I believe Sweden did not have a mandatory lockdown. They never closed the schools. Please correct me if I've got that wrong. And it's interesting to compare statistically and in a fact-based way how the pandemic has evolved in Sweden compared to other countries. My understanding from what I've seen in the media is that it's complicated. If you compare Sweden to Norway, I see Rein Asland, who could perhaps comment, and Norway seems to be an outlier in terms of having had very low impact in deaths from the pandemic. On the other hand, probably Sweden and Norway, just because they're close together geographically, they're not identical in demographics or population density, perhaps. I think we won't know for some years exactly what's happened. I would be very interested if any of our Swedish colleagues, I believe Monica maybe online, or Ulla, Mernish, if you can link with any of our Scandinavian colleagues. It would be interesting as Europeans to reflect on how that has developed, because I'm not sure we should expect there to be a one-size-fits-all solution that's the perfect solution for every geography, for every country, for every political demographic as to how we respond. Some things are scientific facts, the speed of light, the infectious rate of the virus, but what's the most effective way of dealing with it may not be identical in every situation. I simply don't know. If we do have...
Monica Anderson is on, and she's not on mute, so she can say something.
Okay, Monica, I was looking... Okay, now I see you. Sorry, I couldn't see you on the screen. Have I misrepresented the situation in Sweden, or could you perhaps share with us how that's happening there?
No, maybe we can come back to Monica. Okay. A few people have to leave, and it would be good to go back to Michael Levitt, who's 11 p.m. in Shanghai.
Okay. Sorry, Michael, for keeping you up so late. I hadn't realized you were in Shanghai.
So basically, the key thing with COVID is to realize the first thing you have to know is that 150,000 people die in the world every day. Some of those people are old. Many of them are young. Every death is a tragedy to everyone that knows those people. So this means that the 3 million people who've died in the world in the 70 weeks of COVID are about 20 days worth of normal death. 150,000 a day, 3 million, you divide one by the other, and you find that the number of people who've died from COVID equals the number of people who die normally, naturally, very sadly, every single in 20 days. This is very important to realize. I guess we have a lot of death, but people always forget to say, what is the comparison? The stories we've heard from India and Brazil are very concerning, very tragic, but the trouble with seeing stories is they miss the big picture. So on this slide, I have the big picture. It was from a talk that I gave 8 days ago. It's slightly out of date. And what we're giving here is we're calculating the excess death. In every single year, people die, and it's possible using the deaths from previous years in different age groups and the change of the age group population to calculate how many people should normally die in a given period. And then you can say how many people did die in that period and see if the number is more or less. Sometimes you find that less people have died. We're going to see an example of this. So basically, you can then take the number of people who die in what's called excess death. That may maybe sound irrespectful. These are people who die in addition to those you expect. Now, we don't actually know who they are. It's just a number. Let's say we expect 1 million to die and 1,100,000 die, then an extra 100,000 are extra, but it could be anybody. We also don't know what they die of. They could die from traffic accidents, violence, old age, anything. But now what we do is we look at these excess deaths during the time of Corona. And for example, I'm just taking all of 2020 and 2021 up to the time we have data. The data is usually delayed. So typically you have data about maybe 5 weeks ago or 6 weeks ago. Okay, when you look at that data, you can now ask how much excess death as percentage of normal death the different countries have. So let's just take a look on this. I've just looked at European countries. Only a small number of countries in the world actually have the excess death statistically available. I have a separate table for the United States, and I did see a question in chat about Florida being slightly worse than California. But if you take Florida and you divide by the much higher natural death rate in Florida, Florida is significantly better than California. So let's just take a look at the place. So the worst place in the world by far was New York City. New York City is the one concentrated place that really had serious corona. In the worst week, and I've got a picture, I didn't want to do more of the slides, but this just shows that in the worst, this is the natural death rate shown here in this flat line for people over 65, for people under 65. And in this period, from the beginning of April for about 5 weeks, there was a massive death in New York. In fact, for the older people, there were 6 times more deaths than in a normal week. This is quite amazing. For comparison, in places like California or Florida you hear of, it's maybe 50% worse in the worst week. So 6 times is really terrible. So that is an example of a really bad case. Let's look at some other cases. So all of the United States is 13.5%. We were talking about Brazil. I don't know which country has a worse political situation. The political situation in the United States was not exactly logic, rationality at any point. So I think that. Now we look at the situation here. So Chile, a South American country, is about the same as the United States, 12.4%. England and Wales, 12%. France, 6%. Hungary, 3%. Sweden, 2%. That means in Sweden, there were just 2% more excess deaths. In Sweden, in a typical year, you expect 90,000 deaths. This means there were an extra 1,800 deaths out of the 90,000. Now, every death is important. But if the extra death is 2%, that probably could have been saved by stopping driving for some days in the week, certainly outlawing cigarettes, stopping smoking, increasing hospital beds by 20%, etc. Germany, 1.1%. Until a week ago, the excess death in Germany was essentially exactly the same as you would have expected. Germany is one of the countries which has been by far least worst hit. And you can see Germany over here. Other places, Spain was a bad one, 11%. Italy, 11%. Scotland, 6.9%. The whole of Europe together, the average of all the numbers in Europe, 6.4%. Now, what does 6.4% mean of a year? If we go back to talk about days or months, we have 12 months in a year. So 1 month is 8.25% of a year. 6.1%, 4% means that less than 4 weeks of extra death occurred in Europe over a period that was over a period of a year. These are percentages, so it's as a year. Then we come to something that's quite surprising. A number of countries actually had negative deaths. In other words, because of the measures, because of the world situation during COVID, they had less death than you'd expect. New Zealand and Ireland locked down way far from anything, had 7% less deaths than they normally have. Now, that might sound like a great idea, except unless they can find a virus or a vaccine that doesn't stop corona, but actually stops death, they're going to now have an excess of 7% of their population who would normally have died. So they should actually expect a lot of extra deaths in the coming years. I don't think we can stop death. This gets really serious if we look at some of the other countries. Taiwan, the province of China, 5%, Korea, 8%, etc. And we can make an extrapolation, which I'll just quickly jump to, which is a scary bottom line. East Asia was basically the area of the world that was least badly hit. And we can now say, let's imagine that the 5% death deficit actually applies to all of East Asia. That means about 1 million people have been saved due to corona. And this means for those countries, they're going to expect a lot more older people. They're going to have a big, big issue here. And this might sound very, very cruel, but I'm just looking at the facts. So it's really important to realize the big picture. The whole of the northern part of Europe actually did very, very well. Sweden didn't do as well as its neighbors. Germany is the big outlier. Germany has done spectacularly well, better than all the countries that surround it, except perhaps for Denmark. France was better than Spain, England, or Italy. In the United States, just to say one other thing about the United States, here is California and Florida. So California had 55,000 excess death, Florida 31,000. But if you normalize this per million and you normalize by age, Florida is a lot better off. But both of these places have something which is very disturbing. There are excess deaths for young people. Young people in COVID terms is under 65. And if you look at it somewhere in Europe, let's just take, say, Italy or Portugal, you see that there's a big peak in Italy, but then things go down to baseline, another big peak. In the United States, there's generally a trend where there's a lot of young people who are dying, and these young people are dying not when there's a peak in the death of the old people, but all the time. So these could well be deaths that were caused by what we did to society by closing it down. We don't know what that is. It may be suicide. It may be lack of hospital care. It may be depression. It may be excess smoking, excess drinking. But it's very important to realize that the measures that have been taken by most of the world, except perhaps for Sweden, to some extent Switzerland, and maybe Germany, do have a price to them. Lockdown is not for free. Taking a country and closing everything down is not for free. I think the newspapers are now going to fill, once we've got rid of the COVID deaths and the variants have been seen for what they are, as normal variants. If we were to analyze flu the way we analyze COVID, we would find hundreds of times more variants. The newspapers are going to go back to scare stories about children committing suicide, hospital failures, etc. This level of death is very significant. This is the average level of young people's death, 50 per 1,000 per week. It's gone up by about 15%. So in the United States as a whole, young people's deaths have gone up. A similar picture is actually seen in all the Americas. It's surprisingly seen in Canada. It is seen in Chile. And we can only assume that in countries like Brazil, there'll be a lot of extra death of young people, whereas in fact, the old people are the ones who are more susceptible to COVID. So we have to ask ourselves, from what are the young people dying? Young people don't normally, in Europe, the number of young people who die of COVID is 8% of the number of old people. In the United States, in Chile, and I guess in other places, it's 30%. So this is the big question. Another really important question to ask is, where has flu gone? In the last period of COVID, there have been no flu deaths. One of the reasons why these excess death numbers are relatively small is that flu has gone away. What New Zealand has saved is its flu deaths. Australia has saved its flu deaths, Norway, and so on. And people are saying, and I find it hard to believe, that the masks which totally fail to stop COVID are able to completely stop influenza in its steps. Influenza is actually a smaller virus, not very much smaller, but about 2/3 the size. Influenza is a devilish virus, but we do have a vaccine for it. But in previous years, influenza has always come through. So this is the one question we have to ask. The other question we have to ask is, if we look at all the different outbreaks of corona, how come interventions seem to have had so little effect? And we can see that, for example, if you look at the United States, there was a peak, and another peak, another peak. Other countries have more peaks. The one suggestion that there is a limit to how bad corona can get actually comes from New York City. New York City had this massive peak in April, May, and then nothing. For 9 months, nothing. What was this? Incredibly successful mask wearing or herd immunity? Nothing for young people either. The United States as a whole, Florida has some in the summer, then a little bit less in the winter. California held things down like crazy. Lockdown in California was really good, but they couldn't hold it down. It eventually exploded. So basically, it looks like nothing really stops this virus. We don't yet know what could stop it. I start to think that we need to realize that by the time we get the first case or the first death, there's already a huge amount of virus spread. And we need to think of ways to spread the virus cleverly. In the discussion from India, we were hearing that really it was quite a stigma to have corona happening. If I was in any position of power, I would offer the first person, I would insist that everyone measures their temperatures at home. High fever is associated. You can't do PCR kits at home, but you can buy good old-fashioned mercury thermometers for, I would guess, around a couple of dollars. Everyone could measure their temperature, and anyone who finds himself with a temperature, comes in, is tested, and is positive, gets $1,000. If you did that for the first 1,000 or 10,000 cases, you would know exactly how much corona there is in your country. If you have to wait until you have 100 cases, 20 deaths, you've already spread the corona enormously, because the corona for its early period is hidden, and you can't test everybody. You'd have to test everybody every single day. Testing would be incredibly disruptive, because you would take everyone out of their houses, bring them to testing places so they mix. I think another thing to do is to realize that China and I think a lot of the other countries in Southeast Asia seem to be resistant. China really locks down incredibly well, but Japan didn't lock down so well. Taiwan didn't lock down so well. They had corona, but overall, they actually had negative excess deaths. So overall, the measures that Taiwan used that weren't draconian in any way ended up leading to an excess death of -5%. Japan had multiple attacks. Vietnam, which is not exactly a very close country, had a lot of outbreaks that were not a problem. So I think that there was something in the sector of the world reaching down from North Korea to New Zealand that made them less susceptible. I think this is probably due to another coronavirus giving them some level of cross-reactivity, and now they're going to have a problem for this. But the other thing about China is Chinese society is very, very well set up for lockdown. I was in Israel for the first lockdown, and you weren't meant to go around. They didn't use masks initially, but everyone was allowed to go out and buy food. Buy food at a store where the person running the store was not wearing a mask, didn't have any plastic sheet in front of him, and you had to pay with money or a credit card, both involving contact. Now, think of the same situation in China. Almost everyone lives in a compound in China. So in a compound, it is very easy to centrally organize food delivery to everyone's place. In China, everyone pays remotely through their phones, no contact. So it seems to me that we need to think of measures like this. In China today, your temperature has to be measured. As a foreigner coming to China, your temperature is measured for the first 2 weeks. They still think that temperatures are really important. So it seems to me that we missed these clues. We should have had the army or somebody deliver food. It should have been illegal to pay with anything except online. But unfortunately, we fixated on masks. I don't think we should forget about Sweden. Here is Sweden on this graph, 2.1% excess death, 2,000 people. Now, Sweden had 12,000 reported corona deaths. but they had a lot of less flu deaths. And as a result, because they have a lot of flu, this is the number that they got. So I think we should really think that this is a very, very difficult problem. We need to think different. We need to think out of the box. And it's not nobody knows the right answer. It's all very well to say these certain drugs are not good. But the fact is that most of the studies done on masks have failed to show that masks really, really stop infection. Today I heard that one of the good things about masks are that when you wear a mask, your throat is more humid. And maybe that is good. It's probably comfortable. And certainly when it's cold, I like to wear a mask because it keeps you warm. Anyway, that's what I wanted to say. It's a very brief summary, but I think the important point is just to remember, easy number, the total reported corona deaths are 20 days of normal death. And typically, for example, in the United States, if we used reported deaths, not excess deaths, it would be about twice as many. So it's very likely that the actual world excess death, something that is impossible to ever estimate because people don't keep the records of who dies and when they die, probably amounts to less than 2 weeks of normal death. 2 weeks of normal death would be 4% of our annual death rate, 4 or 5%. So it really isn't a huge thing. I do think that one lesson for this means we need to record deaths when they happen. I did some work on Brazil and was told that there are 2 official databases, both of which are badly wrong. Everyone knows they're wrong. I used this to make some calculations. That was my mistake. I'd forgotten that government data is not always reliable. So we need to realize that the actual level here has been small. If you calculate just the predicted loss of death from drop in world GDP, it will be in excess of COVID, probably at least by a factor of 10. And then we have to worry about all the deaths that were caused not by loss of GDP, but from postponed hospital visits, from children not going to school, from people separating and not getting the herd immunity against other viruses. Flu could come back next year with a vengeance if we've not had flu for a whole year. Anyway, that's all I wanted to say.
Yeah, I think, thank you very much, Michael. I think a number of points, again, people making some comments in the chat. I mean, very helpful to have a fact-based analysis of statistics on death rates and their comparison in different geographical areas and situations. Clearly, if we wind the clock back a year when you were previously with us or before, one of the problems is many of these analyses are best done looking backwards when we have all the data, and the politicians, I guess, have to respond when we don't quite know what the infectivity rate will be. I guess one of the other issues we have to bear in mind is that the impact on society, as you just mentioned, of any virus and of the measures taken to prevent it isn't just deaths, but it's also measured in, like one of my collaborators is head of oncology at the local hospital. He's dealing with a terrible situation because of people who will now die of cancer because the hospitals were closed for dealing with COVID patients. There may be long-term impacts on health where people haven't died. They're not recorded in the statistics, but they have long debilitating health problems that affect their ability to work in the economy. I guess what would be really important is how do we do it better in future when the next pandemic comes along? What have we really learned? And
I have a very simple question in here. I think that we've had other problems, and generally panic was not the answer that we used. And unfortunately, perhaps because of pictures from Wuhan, pictures from Italy, the world went into panic mode. In panic mode, no one wanted to listen. People did say that this is likely to be 3 or 4, maybe 5 times worse than flu. People did say that, look at Sweden. I mean, Sweden, it was quite clear. I remember Sweden basically peaked without any measures on the 2nd of May. So by the end of May, it was absolutely clear that Sweden's scheme had worked. It didn't have 100,000 deaths as had been predicted. But I do think that people are notoriously bad at estimating risk. As a joke here, it turns out I'm almost 74 years old. And at my age, I have a 0.25% chance of dying every month. I mean, that's just the way it is. It's 3% a year. You divide by 12, and it's 0.25% a month. So I was telling my wife, it's as if she had 400 husbands and one died every month. So then she basically asked, well, how long would it take for me to get rid of them all? And then I had to explain to her that it would be longer than 400 months because the actual thing is decaying exponentially. So, but, if I was 85, it would probably be 1% a month. Now, I speak as somebody who, has a mother 106 years old who is perfectly healthy and living. But the fact remains, people die. And this is the first thing to realize. This should have been made obvious to everybody. I really feel that I'm not a conspiracy theorist, but I do think we need to look at who were the winners and who were the losers. And very sadly, in the world, the winners were the rich, elderly people, and the losers were the young, less wealthy people. Whether it's schools lost, people who can't buy houses, people who, freshman student at Stanford spent their first year zooming in or not zooming in. So this may be accidental, and you could actually argue this always happens. When I get conspiracy theorists I start to think that perhaps the world needs a major event every 50 to 70 years. And whatever we say, Corona has been 1,000 times better than the Second World War, maybe 1,000,000 times better than the Second World War in terms of its years of lost life. So this is a relatively easy way to get everybody worked up. And the net impact, at least from the disease, is relatively small. And we cannot forget this, and nothing can change this. And unfortunately, people talk about all these variants. Now, just a little bit of biology, which anyone who knows basic viral structure would know, coronavirus has a genome of 32,000 nucleotides. It's about 3 times longer than flu. And as a result, flu doesn't have any system for proof checking. So flu virus loves to make mistakes. Flu virus mutates like crazy. In fact, it mutates so crazily that it would actually never survive. And the way it survives is that there actually are 5 separate segments to the RNA in the flu virus. And this means that if you screw up one of your 5 segments, you can borrow one from another variant inside the same cell making it. So flu is the mother of all viruses. I would love somebody to do a situation where we spend as much effort PCRing flu and then saying everyone who had a flu virus on them died of flu. We would find flu to be an enormously bad disease. One reason why we don't know what flu does is that flu always occurs in the winter. But if we look at New Zealand, this year, New Zealand has lost its flu peak. So if you want to know how bad flu is, you need to simply go. I can show you very quickly. I share my screen for a second. If we go back to these are just excess death curves in the world. The peaks are in the winter and the valleys are in the summer. If flu is totally responsible for all these peaks, and New Zealand suggests that, then flu deaths in the world are much, much larger than we've been estimating. Normally, flu deaths are estimated as what we see. So, for example, this is the average line of the winter in Europe, and the flu is this. In the United States, this is the average, flu is this. But if you took the baseline over here, this flat line over here, then flu would actually be, I would imagine, rather comparable to corona. And we could never do that before because we never knew what it was like not to have flu. Now, people haven't yet realized this, but the line for New Zealand is totally flat. New Zealand has no peak at all. And New Zealand is a relatively far from the equator. So New Zealand actually has quite severe flu. So that's why New Zealand's death rate is down by 7%. Anyway, so I think we're going to discover that flu is about 5 to 6% of background death. Corona is about 5 or 6%. And these things are going to be comparable. But one of the things that would get you thrown off YouTube was to say that corona is like flu. And the fact that that would even be an issue is a level of stupidity that the world has undergone. I would say, for all the young people here, look long and hard and really ask yourselves, can the baby boomers who have got you here, can they be trusted anymore? I don't think so. Anyway, that's it.
So Mike, thank you. Just as a final point, because I know time's pressing and I appreciate it's very late for you. One of the things we're discussing is how we can make a positive impact in communicating science and discussing difficult issues in a fact-based way. You're someone who is a very famous scientist who has become engaged in a variety of media, social media, and interactions that have transcended your immediate area of expertise. It would be fair to say that you've also attracted some controversy and comments. Some people maybe don't like the conclusions you're coming to. Do you have any thoughts you'd like to share with us or comments on your experience of interacting with social media and with the public or the scientific community?
So basically, my interaction on social media has been almost entirely with Twitter. I did play with Facebook and I put some things on YouTube. But in Twitter, in March last year, I had 30 followers. And I'm now about to cross 90,000. So there's been a massive increase. I tweeted, I think, 1,600 tweets, all of which were basically scientific, lots and lots of graphs. So firstly, I found it, the people being nasty, you often get nasty referees reports. Anybody who stops science, I guess they get a nasty referees report, shouldn't be a scientist. I also had to remind myself all the time of what Max Perutz always said, in science, truth wins. So when you arm yourself with that, I really don't care. Now, I was lucky because no one could fire me. Probably no one could really shut me up. And a lot of my colleagues were simply scared to speak. One of the good things is that at Stanford, Stanford actually has a right-wing think tank embedded into the university. Condoleezza Rice was from Stanford. And as a result, I think Stanford is much more open to dissension. I actually like the feedback from Twitter. A lot of good ideas, a lot of things you hear about. Just today I heard that masks keep your throat more moist. At some point, people started to send me material, but I also turned it around and asked people to do research for me. I would send them data and say, could you work this up? These are people who I don't know, they're usually not scientists. They're data scientists, often just normal people who would read papers and make summaries. So I think it's a very good feeling to reach out widely. And it's also a fairly big time thing. I have a paper that I had in preprint form in June last year, and only now have I found enough energy to finish that paper. And it's going to be very interesting, and it's going to be a very nice paper. Whether anyone will agree to referee it or not is a separate issue. But, that's the way it is. So I think Twitter is a very good medium. It's good for people to be able to speak out freely. One interesting thing was, and I think many people experienced this, when President Trump left Twitter in January, I lost about 5% of my followers. So at least that indicated some idea of the demographic of my followers. Since then, things have come back. I think a lot of people actually want information, and it's very difficult to get it. On the other hand, these media do require almost 24/7 attention. If you say something, and then somebody somewhere asks a question that's relevant, even if that person is not important, even if that person has no followers, even if that person is nobody, often it's really worthwhile to reply, often using that as a way to illustrate a point. Because one problem is that in 240 words, it's incredibly easy to cause misunderstandings. It's like a word game to play it, but it causes misunderstandings at an incredible rate. And usually the stream of Twitter flows by. It's actually quite hard to use Twitter effectively. I continually dump my tweets and index them and know exactly what I've said, because it's very easy to forget what you say. But I do think, Angus, that EMBL has been almost the only scientific organization that has reached out and done things like this. The Nobel Foundation hasn't. I think the National Academy is going to do something with the Nobel Foundation next week. The Royal Society hasn't. Nobel, Linda had a virtual meeting, and I guess said what I wanted to say, but there really wasn't a whole lot of participation. So all of these chats going by, they could be tweets.
Yeah,
these chats could be tweets that people react to. It's really hard to react to them on a level like this. So just to tell you, my Twitter handle is a very embarrassing one. It's one that I created in 2016 to get refunds from credit card companies and airlines that were trying to cheat me. So my Twitter handle, I don't have written here, is, maybe I do on my first slide, is basically M Levitt, just my first initial, my name, _ NP203. That's Nobel Prize 213. I stuck it in there because it really got a great response from Costco and Citibank and American Express. And then I was stuck with it. And a lot of the grief I've got has been because of that. Believe me, anyone who knows me would know that's the last name I would choose. But, it's the name I have. And
sorry, I'm going to have to jump in.
Yeah. So, sorry. Michael, thank you. Thank you very much.
Bye, everybody. I'm going to go to bed.
Okay. Thank you very much. Sorry, Gregor, can we bring you in? And this is
coffee. Bye.
Hi, Gregor. Thank you for your patience and staying on.
Yeah, it was definitely interesting, and nevertheless, so even though I'm not currently working in science, so it's still a thing I'm following. Obviously, my wife is still working in science, so that's daily discussions we have. We have 2 kids, so there, of course, we have all the discuss the reasonability of the measures and how we ourselves. Just estimate the risks and how to judge what we should do or what we shouldn't do. But nevertheless, so I'm here for some the more light and enlightening topic. So no deaths from my side. So that's So short story for my how I became involved in coffee. I think it was around 2013 when I left EMBL, or it was end of 2012. I'm not entirely sure anymore, but and basically my first idea was kind of to try and sell complexity. And as this was not that easy, especially from a marketing point of view. And then coffee was came alongside my life. So that was, I knew people and they were working in coffee business in terms of roasting and preparing coffee. And I was really just slowly sliding into this business. Or first of all, it was just the fun of, the joy of of having a coffee, of having a really good coffee. And so that was basically the starter, and then I became a coffee roaster during the years, and beginning jumping now to the beginning of last year, I separated from my first partner with whom I had we were running a coffee roastery, but nevertheless we had in my surrounding my friends, or one of my friends. He was kind of approaching me in terms of, I know you're doing something with coffee, and I know that you're paying attention to, how's the coffee produced and trying to make an impact on the coffee market in terms of fair wages, protecting the environment, and don't be too extensive, and a fair share for the coffee producing countries. And all that was already kind of in the whole coffee idea as long as we approached it, and so my friend became Johan is his name, and he's actually a mathematician and is still working as a mathematician, and he had this idea of just doing something more hands-on for a better future. So, and one thing was that we are simply trying to design or to provide a product which is kind of gives an easy access for people to do something which makes sense in terms of what can we do and what are our urgent problems on the world. So that's climate change. So as we were founding BetterFutureCoffee, so COVID was merely just news from China. So that was not impacting us too much at that time. But of course, when we wanted to start, and our initial idea was to build up a roastery and then roast ourselves. And of course, that was kind of just stopped relatively brutal in terms of, in March, we couldn't move anywhere. So there was no building up any roasteries and things. And but we were something determined to tackle the problem that COVID is a thing and it is a current problem, but so climate change will will be with us in the next 20, 50, 100 years. So, and we wanted still something to tackle this and keep this going, even though that we had some in our daily life more urgent COVID related issues. And
we great. So I'll take responsibility for this, and we're very short of time.
Okay. Yep.
What I was hoping we could do is actually share your story here. We collect information and we post this online to share with people. So I'm hoping that's what we can do with you as well. And just as people, some of the people starting to drop off, I was particularly keen that we announce the winners of the competition who are going to get your coffee and actually get to taste it.
So one thing is what I would like to add, and of course I feel really honored that the Alumni Association chose my coffee as a present, but nevertheless I would recommend and encourage every one of you, at least the coffee drinkers with you, just to get your coffee from your local roasteries, because so one thing is if you really want to go for just tackle climate change and be fair to the producers, then of course the locally produced, locally roasted coffee is in most cases something with things you can easily handle. And our idea of BetterFutureCoffee is not that we send it basically around the world. So even though, of course, I would like to provide coffee for every one of you, but I think from a better future point of view, it makes more sense if you go to your local roasteries and enjoy the coffee locally. And in case you are in Heidelberg, just come around or just let me know.
Well, thank you. I think that's incredibly well said, and I'd like to thank you again for coming on and sharing this with us. There is an article, Lush says, on the EMBL website about you and your coffee. She can add a link to that for people to find, and I think that that's a great example, and I really take on board the point about thinking globally and acting locally, which I think is what you're saying. I'd like to thank everyone who contributed this week, everyone who contributed in the chat. Again, wish happy birthday to Coffee with EMBL. I'd like to thank everyone for participating over the last year and making it as enjoyable and interesting an event as it has been. And I look forward to more feedback from you and getting your comments for ideas for future events and future speakers.